Have you noticed this? Your face looks different, a little puffier here, a little softer there, tired even when you've slept. Why is that happening? Maybe you thought it's just aging or stress, or maybe you blamed your diet. But if any of these signs feel familiar, for you or for someone you care about, this video is for you. And what surprises many people is that the face is often one of the first places where chronic stress starts to show. Now, before you jump to conclusions, these changes don't always mean something serious. Many things can cause facial puffiness, and it's always wise to talk to a doctor, but there's one pattern many people are quietly experiencing, and it's often reversible. Today, we'll explore the 7 subtle signs, the science behind stress and your face, and 4 practical steps that may help. If you find this useful, hit subscribe. This is CorVita Doctor. Check out our videos on sleep, fatty liver, and metabolic syndrome, all linked to today's topic. Part 1. What is cortisol face? So, what exactly is cortisol face? It's a term often used to describe facial changes that some people notice during periods of chronic stress. Medically, a very extreme version is called moon face, a rounder, fuller look. But for most people, it's not that. It's a milder, gradual puffiness from how cortisol may shift fat and fluid in the body. This isn't overnight bloating, it's a gradual change. You might notice your face looks different in photos, your jawline isn't as sharp, or your face feels heavy in the morning. But here's what most social media videos get wrong. True, pathological cortisol face, Cushing syndrome, is rare. It's caused by tumors, adrenal problems, or long-term steroid medications. What most people actually experience from daily stress is facial puffiness due to a mix of factors: poor diet, high salt, alcohol, bad sleep. That doesn't mean your face isn't changing. It is. But it's likely stress-driven fat redistribution and lifestyle-related swelling. And that's good news, because you can often improve it without medical intervention. Let's check your signs. Part 2. The 7 signs. Self-check. Here are 7 signs that may suggest elevated cortisol is affecting your face and body. Pause and check yourself. These signs can have multiple causes. They are not a diagnosis, but if you recognize several, it's worth a conversation with your doctor. 1. Rounder, fuller face. Your face shape may appear less oval, more circular. 2. Puffy cheeks. Especially in the morning, your cheeks may look fuller. 3. Softer. Jawline. The sharp angle under your chin may become less defined. 4. Increased acne or oily skin. Cortisol may contribute to increased oil production, which can worsen acne. 5. Thinning skin and stretch marks. High cortisol can break down collagen over time. 6. Darkening of skin folds, often a sign of insulin resistance. Chronic stress and cortisol can worsen it. 7. Hair changes. Cortisol may slow hair growth or contribute to shedding. If you recognize 2 or 3 of these, stress may be one possible contributing factor worth discussing with your healthcare professional. Now, let's understand the hidden mechanism. Part 3. The science, the cascade. Behind these changes is cortisol. When you're stressed, your brain triggers a chain reaction. Adrenal glands release cortisol. In short bursts, it's helpful. Energy, focus. But when stress becomes chronic, cortisol stays high. This can encourage muscle protein breakdown, providing building blocks for glucose. This may contribute to higher insulin over time, which may contribute to changes in body fat distribution. So cortisol may set off a cascade: muscle breakdown, higher blood sugar, insulin spikes, and fat storage in certain areas. This shares roots with metabolic syndrome. The face is often the visible tip of a deeper metabolic iceberg. Remember our video on metabolic syndrome? Same stress, same cortisol, same insulin resistance patterns. Addressing one may help the other. Part 4. The 4-step reversal plan. The good news: cortisol face can improve dramatically. 4 steps. Step 1. Prioritize sleep. Sleep is the most powerful cortisol lowering tool. Aim for 7 to 8 hours. Same bedtime, same wake time. Your morning face may feel less puffy within a couple of weeks. Step 2. Breathe to calm the vagus nerve. Deep diaphragmatic breathing can activate your vagus nerve, signaling your brain to reduce cortisol. Inhale 4 seconds, hold 4, exhale 6, 5 minutes, twice a day. Step 3. Move gently, not excessively moderate movement. Walking, yoga, light cycling tends to lower cortisol. Excessive high intensity without recovery can spike it. A 30-minute daily walk away from your phone is a solid start. Step 4. Eat to support insulin balance. Because chronic stress and elevated cortisol may contribute to insulin resistance, aim to lower insulin through diet. Reduce constant snacking. For many people, 2 or 3 well-spaced meals a day can be beneficial. Consult your doctor if you have a medical condition like diabetes or are pregnant. Cut down sugar and refined starches. Limit ultra-processed foods and focus on whole food sources of fat. Get adequate protein from real food. Lean meat, poultry, fish, eggs, or lentils. Don't forget magnesium, vitamin D, and B vitamins. Some people notice their face slimming down relatively early when they adopt these habits. Part 5. Timeline and individual variation. Everyone's body responds differently. Many people notice reduced puffiness within the first couple of weeks as water weight drops. Visible changes to facial shape often take a couple of months or more, some sooner, some later. Patience and consistency are key. When your face reflects less stress, it's often a sign your cortisol and metabolic health are improving. 4 steps. Sleep deeply, breathe intentionally, move gently, eat to support balance. Your challenge? Take a photo of your face tonight. Follow these habits for a few weeks and see the difference for yourself. Important, this video is for general educational purposes, not medical advice. True Cushing syndrome is serious. If you have severe swelling, stretch marks, muscle weakness, or are on steroid medications, please consult your doctor. Share this with someone under chronic stress. Hit subscribe and the bell, drop a comment. We read and reply. Next on CorVita Doctor, fatty liver disease. Many adults may have it without knowing it. See you there.